For years, hospital workers have been struggling with the challenge of moving patients in bed. The problem arises when the head of the bed is raised and gravity causes the patient to slide down toward the foot of the bed. It's a problem that places both the hospital worker and the patient at risk, and is compounded by the fact that this can occur many times per patient every day. Nurses and aides currently use a slider sheet to move heavy patients. This technique requires multiple operators and can still put the patient and caregivers at risk for injuries, like patients who have hip surgeries being rolled, exposing them to pain. The lack of an effective product, time issues, and need for extra personnel results in caregivers manually boosting patients, risking neck, back, and shoulder injuries, and distracting them from their primary caregiving responsibilities or forcing individuals to go on disability leave. The PowerSlider is safe, quick, and effectively reduces the amount of people needed to boost a patient, eliminating the leading cause of injuries affecting the nursing profession today, while keeping the patient stable and safe from pain. The PowerSlider is located at the head of the bed. Two caregivers pull the doubled slider sheet out of the device and under the patient using the established technique and without need to roll the patient. After the sheet is under the patient, the caregiver pushes a button on the device and the patient is boosted toward the head of the bed. When the patient is boosted to a comfortable position, the caregiver pushes a second button and the slider sheet retracts back into the device with no rolling or moving the patient. The PowerSlider consists of a mechanized rolling system and a slider sheet. It can boost patients weighing up to 500 pounds, maintaining the dignity of the patient and keeping them safe. Using the PowerSlider eliminates the need for multiple caregivers, saving time and manpower. Patient movement is also a problem when transferring from a hospital cart to a bed and vice versa, requiring multiple caregivers and exposing both the patient and the caregivers to further pain or injury. PowerSlider is a solution for this as well. A longer, thinner PowerSlider for hospital carts uses the same technique to transfer a patient from a hospital cart to a bed or the other way. This lowers the risk of injury for both the patient and the caregiver while reducing the number of caregivers needed. If a slider sheet becomes soiled, it is easily removed from the device and another sheet can be put on quickly to replace it. The device itself is constructed to be quickly, easily, and safely cleaned. PowerSlider version 2 will have the additional feature of 2 inflatable pockets, which each separately with the press of a button will inflate, safely repositioning a patient either to the left or to the right, allowing a caregiver to place a pillow underneath the patient without the risk of injury to either the patient or the caregiver. PowerSlider, the next standard of care.